YouTube.
Hello YouTube.
It's us again, Chris and Sherry. This is our second video, and in this video we want to talk about getting started with the tools you need and things to begin with when you're going through the process of artificial insemination. So, on the last video we told you that we found a clinic here in the Atlanta area. Through that clinic we had a consultation with one of the doctors. The consultation was, about an hour?
Yep.
And we talked about just our plans and our relationship and our setup. On that day, they did blood work of me. They actually, before they did that, they kind of assessed Sherry and I to see who was going to be the best candidate. I mean, really, she had already made up her mind that I was going to carry it, and so the doctor confirmed it based off of our age and eggs and all that stuff. So anyway, on that day, they did blood work of me, tested for STDs, and just your basic routine testing. I also went to see my gynecologist and had a pap smear done just to test for diseases that you can't pick up through blood work, which is like gonorrhea, chlamydia, some things like that. So got that testing out the way. Everything checked out great. Of course, we've been together for 10 years. We don't have any concerns there, or I would kill her. Not on tape. I'm gonna edit that out.
Yeah.
I'm gonna edit that out. But we did that. If you don't know, I used to believe that my cycle was from the day my period started to the day my period ended, which was 7 days or 4 days, however long it is. And that is not actually the case. Your cycle is actually the day your period begins, actual flowing, to the last day of your next period. I mean, the day before your next period. So it can range from 28 to 30 plus days. So the first day of your cycle, again, is the day you actually start your period, and your cycle ends the day before your next period. So on day 3 of my cycle, I went in to have a vaginal sonogram. And ladies, I don't know if you've ever had a vaginal sonogram when you're in your period, but it's a different experience. So I'll just say that. So I had to have a vaginal sonogram. They do an egg count at that time, I think. Is that what the sonogram was for?
I believe so.
Yeah, they did an egg count. It doesn't hurt at all. I mean, it's like, they don't even use the pap smear tool that opens you up. It's just the little tube they stick in you to do the sonogram. On day 6 or 7 of my cycle, I then went in for a HSG test, which is the test where they inject dye into your uterus just to see the shape of your uterus, make sure you don't have any cysts or fibroids, make sure there's no blockage in your tubes. That test I did a lot of research on, and that test was a little painful. It felt like contractions. I kind of almost got talked out of this little whole process because I have flashback of some contractions. So the good thing though, once the dye stops, which the test was what, 20 minutes maybe, 15 minutes maybe?
15 minutes, but the dye process was only probably about 5 minutes.
Yeah. So once they put the dye in, it starts to hurt then, and then once they stop the dye, it stops hurting immediately afterwards. I did have a weird sensation in my ovaries or my uterus area, which that's been a couple of months since I've had that test. I still kind of have it. It doesn't hurt, it just feels different. And the doctor just kind of said it's just cleared out. I usually ovulate between 16 and day 19 of my cycle. After I had that test, that HSG test, I actually ovulated on day 13. So that's something to be mindful of if you're ovulating, if you're tracking your ovulation and you're hoping to get pregnant the next month. After you have that test, your ovulation may very well change. After that, what else? We start testing our ovulation.
Right.
We actually started a couple of months with testing our ovulation, and our doctor suggested this Clear Blue Easy.
This is the actual kit that our doctor suggested that you use, which actually, instead of giving you the faint lines that sometimes can be confusing, it gives you a happy face or no face at all. And basically with the ovulation, what you're testing for is your what's called LH surge. And what it is that day, and it's the 24 to 48 hour
Right.
period, is said to be the greatest chance of you getting pregnant, and it's called the LH surge, and that's what the ovulation kit predicts. It predicts when your LH surge is going on. So I'll show this again. It's a clear blue easy. We have a 1 month supply here. It's very, you want to definitely make sure that you are well aware of how to detect ovulation, and you've done a great deal of practice before you actually are ready to inseminate, because you very well could miss your ovulation if you haven't done it, previously to being inseminated.
Mm-hmm. And the LH surge, what that is a chemical that your body releases right before the egg is released into the fallopian tubes. So pregnancy can only take place within the fallopian tubes. That's where the sperm has to meet the egg for it to take place. So that LH surge is released in your body, kind of letting your body know, hey, here comes the egg. So you want to have the sperm in there waiting for the egg. Sperm can only survive anywhere from 24 to 48 hours. Some can survive 36 hours, depending on if you're using fresh or frozen. So when you have that LH surge, if you're going to a clinic, our doctor advises us, once we see the happy face, come in the next day, and that's when they'll do insemination. Some other things that we use, I've always been a vitamin taker all my life. My children take vitamins. I try to get my wife to take vitamins. So it was natural for me to switch over to the prenatal vitamin that my doctor suggested that we do. This particular prenatal vitamin has two parts. One is a vitamin and one is a DHA tablet. The DHA tablet, it's an ingredient, a mineral that they say you should have in your body for when you're trying to get pregnant, just for the brain development of the child. I couldn't swallow the tablet. They would get stuck in my throat for 3 and 4 days at a time. So instead of doing that, I actually take flaxseed oil to get my omega-3s, 6s and 9s. So I've taken flaxseed oil forever. So I just continue taking the flaxseed oil, and I use the 1-a-day prenatal vitamin.
And that's what the bottle looks like. It basically is just 1-a-day. If you look in the vitamin section, it'll say 1-a-day women's prenatal vitamin, and most of them come in a 2-pack.
Yeah, the one that comes in a 2-pack. The other package to that actually has a DHA tablet. Like I said, I couldn't swallow DHA tablets. It was getting stuck in my throat. It was swelling. So I just decided to take my flaxseed oil instead. But if you're trying to conceive, you want to take your vitamins at least 3 months before you're trying to conceive, just to make sure you have all the necessary minerals and vitamins in your body. You want to make sure you're taking extra folic acid. Some things that you can follow with your doctor about that you should already have in your body. Of course, if you smoke, you want to make sure you stop that as soon as possible. You want to make sure you're exercising, not necessarily trying to lose a bunch of weight, but just making sure you feel good and you're physically able to chase a little one around the house, give birth, and all the things that you need for having a baby. So those are the tools that we got started with. Anything else you can think of as far as the tools?
No, that's it.
Yeah. If you guys have any questions about those, you can certainly send us an email. Do your research about the things you need to get started for the best chance of you having a healthy, successful pregnancy and a healthy child. It's hard enough being a parent. You don't want to be a parent to a child that has concerns if you can help it. Okay?
Until next time, that's all for now. We'll see you again soon. Thanks.
Seal it with a kiss. I always had to get my sugar in.